And I must say that the person who really devolved the Ministry of Health made a great mistake, because the problems that we have seen and the problems the ministry is undergoing is as a result of being devolved. And you know, health is universal. And because health is universal, it must be equal in the whole country. And it is the responsibility of the government to provide good health services to its citizens. And I find it queer and unique that when health was devolved, health services in this country has gone down, although the Council of Governors are pretending to be doing good work, but they are not doing anything, and they are doing a lot of disservice to members of this country, because devolving Ministry of Health is like killing Ministry of Health. And I must pray that one day, one time, when we have a referendum in this country, Ministry of Health must be taken back to national government to be managed by the national government, because health is universal and health must be managed from one institution. Two, it has really affected delivery of service. We have the free maternity services, which has really gone down compared to that time when it was a national government. The free maternity money have been embezzled by the county governments. They have used it to attain other activities they want to do. It is not serving the purpose when it was implemented. And I must say that money, so much of that money is going into waste. And unlike the time when the money was being channeled to the health facility straight, now that it's being channeled through NHIF, and it is a detailed procedure to follow until it reaches the common mwananchi. I must tell Kenyans to change their approach, and that money could be utilized in a better and a very good way. Before devolution, that money used to serve the purpose. We have the program for that our first lady started this country, Beyond Zero, which could have been done very well if it was being manned by the national government. Right now, you go to every county, those vehicles are standing outside, they are parked and they never move, and it is not meeting the intended purpose. And that program was being run by nurses, and most of the nurses now are outside. That program could be run well if nurses were being manned by the national government. There is a bill that went to Parliament last time. We wanted a Health Service Commission, which was not factored in our constitution, and that has done a lot of disservice to this country. Two, we wrote a bill that was going to Parliament to be able to get a Human Resource Advisory Authority, which could deal with human resource, and it went to second reading. And now that bill did not sail through until the last reading, I must call upon the Parliamentary Committee on Health to follow on that bill. This Parliament, the Parliament for 2012, the 12th Parliament should be able to follow that and put it to pass, because it will really help human resource in this country. We'll not be calling for strikes every now and then. We'll have one body that will manage human resource in Ministry of Health, like the way it is being managed in the Ministry of Education. It is going on well with teachers because they have Teacher Service Commission. This country requires Health Service Commission so that it will function well. We will be able to meet the World Health Organization's score, and we will score well if we have one unified body that is running Ministry of Health in this country. Otherwise, most of the projects that the county governments are doing are shoddy. They are doing work that is not perfect, and I must say, Ministry of Health should be reported back to national government for better delivery of service to Kenyans.